In terms of the sensory experience in a healthcare setting, a GP surgery, for example, it's something I've experienced as a patient, and it's something I've supported my autistic patients with as a nurse. In the mental health rehab setting, our patients their physical health care remains the responsibility of the GP. So they register with a local GP practice, and we liaise with them, and they attend the surgery as they would. It's part of the model of care, and it's part of the rehabilitation process, and it's part of being a part of society. Sensory-wise, the most common thing is usually waiting in a waiting room. When we look at the sensory profile of something like a waiting room or a consulting room, we have fluorescent lights 99 times out of 100. We have the radio on or music playing in the background, which may well be for confidentiality reasons, but we have phones ringing. Phones is a huge problem. I know with the pandemic, the respiratory virus, there are a lot of perspex screens up for safety, and when you've got fluorescent lights and a perspex screen, that glare and reflection can be really, really distracting and unpleasant for somebody who experiences sensory stimulus in a different way to what you would normally see. A big thing is also the smells in a waiting room. So if you've got lots and lots of people in a room and they're all there to see a doctor because they've got some sort of health problem, smells can be a really big part of that. So people who have BO, for example, small children who have dirty nappies, there's often a toilet in the room. There is the smell of cleaning chemicals, air fresheners in an attempt to cover up or prevent bad smells. Children make an awful lot of smells. They smell like sweet, sticky, snotty, and that can be really difficult when you also think about the noise that's produced. Children who are unwell or in a situation where they are bored or distressed will make screaming noises or be watching an iPad or reading with a parent. Either way, there is noise coming from that interaction the whole time. Then the toilet's flushing and the phone is ringing, and then the receptionist's answering the phone, and then the doorbell goes because there's a delivery. And then someone else walks in, the doors open and slam shut behind them. And then someone's being called from the waiting room by the doctor, and the fluorescent lights are on the whole time, and the whole experience is overwhelming. You've got all of that sensory input to process, makes a much bigger cognitive workload for your neurology, for your brain. And that leaves a lot less wiggle room, if you like, or a lot less capacity in the system to process the verbal information you'll be given, the questions you're asked, to consider answers, to weigh up facts and decisions. So a really good solution would be to allow autistic patients, and I'm not saying it's just autistic patients, if you've got people someone who has a migraine who is really sensitive to light and sound and smells, potentially, they would also need some sort of accommodation. So it's not just autistic people. Not just making adjustments, but just considering the needs of everybody, and considering everybody is a different person and has a different set of needs and preferences, is really key to making services better for everyone, not just autistic people. Is there an option? I'm not suggesting we should give everybody a private waiting room where they can sit on their own and listen to whale sounds or whatever is relaxing for them. If it would help for them to wait outside, if it would be helpful for someone to wait in the waiting room and then go and get them when it's done, or would it be practical for them to wait in the car and you could call them on their mobile phone when the patient before them goes in. All of these things can mitigate some of that extrasensory information and make the whole experience more accessible and more meaningful, and altogether less unpleasant. Therefore, improving engagement, hopefully, and reducing risks. So lighting, fluorescent lights is one of my bugbears. When we've got windows open and then the fluorescent lights are on at the same time, we think, is it necessary? Why do we need those lights on in the first place? Can we just turn them off? Obviously, if that's going to be dangerous for visually impaired people, then we might have to reevaluate that kind of adaptation and say, well, if we need the lights on, do they have to be fluorescent lights because these are really unpleasant and they are actively discouraging people from coming to the surgery and engaging with healthcare? The telephone. If somebody is sat at that desk every minute of every day, does it need to make a noise? Can we turn the ringer down or off? Is there a light that flashes instead? Little tiny considerations like this that might seem insignificant or inconsequential for the majority of the population can really mean an awful lot to somebody who is struggling with the demands of the environment, and then that in turn impacts accessibility, engagement, and outcomes.
Self-injury is also a potential risk factor for suicidality in autistic people, but there's a lot we don't understand here. Autistic adults often talk about self-injury in benign or even beneficial ways as a means of coping or emotion regulation. And it might be that not all forms of self-injury are associated with suicidality. However, research does suggest that engaging in self-injury could be associated with later suicide. So it's an area that's very important for future research to investigate.
As part of the continuing problem with the leg ulcers, or leg ulcer as it was at that point in time, my other leg started suddenly breaking down. I'd got a small cut on it that had scabbed over, but the rest of the leg was turning angry red and in some cases black. And along with that came absolutely severe pain. I'm talking number 11 on the pain scale. I went to A&E to try and get some pain relief. Along with the obviously anxieties of going to A&E and not knowing how long you're going to wait and everything else, I found that when I spoke to the triage nurse, she didn't really listen. Again, I told them I was autistic, but they didn't really listen. In fact, they actually referred me through to a wound dressing section of A&E. And I sat there and I was there another hour or so, and I suddenly realised that actually I was in the wrong place. I wasn't here to get the wound dressed. I was actually here because of the levels of pain. Now, when I originally went in, the waiting time on the screen said 1 hour and 15 minutes. I'd already been there 2 hours, and then I was sent back to A&E to rejoin the queue, and they said, oh, it could be another 2 or so hours. Despite what the screen was saying, they said I'd just joined the queue back as though I'd just arrived in. So that again raised the anxiety levels. Now in the A&E, they had announcements, and the announcements were telling you about the COVID rules, and they were telling you about the entrance to the hospital was shut and use a different entrance. And there was another one in there as well, which I can't remember at this moment, but they lasted, I ended up timing them, they lasted in 1 minute and 50 seconds, but they were on a 3-minute loop constantly. So you can imagine 1 minute to 50 seconds, 1 minute of silence, and then 1 minute and 50 seconds of exactly the same thing over and over and over and over for 2 hours. And I reached the point where I was completely and utterly saturated with it. My anxiety levels were sky high. Every time there was silence, I'd be waiting, thinking, they'll stop it. They'll stop it. Oh God, it started again. They'll stop it. Oh, it's God, it started again. Oh God, it started again. And my anxiety levels were sky high. Went to reception and said, is there anywhere I can wait out of this, or is there any way you can turn this down or turn it off? I was told no, there wasn't. I said, can I just go through into a cubicle or something so I can get away from this noise? I really need to get away from this noise. No, you'll have to wait and deal with it. And again, I had another massive meltdown at that point in time. I started shouting at them, and again, shame and humiliation. I didn't want to be doing this, but I needed that release, and I had to go outside. And again, I was sobbing outside on one of the chairs outside. Fortunately, I think one of the A&E nurses came out to me and kind of understood what I was going through, and said, what we'll do is you can wait out here, because it was during the hot summer. You can wait out here and we'll call you in when it's your turn. And I said, that's fine. Eventually they called me in, and I ended up walking out with morphine of all things, believe it or not. Then there was another time, because of the levels of pain and because nobody was taking the fact that my leg was going black seriously, 3 days later, we paid to see a consultant, and they took one look at my leg. This is, bearing in mind, this was just 3 days later than the original one, and I'd gone in because my leg was black and painful. He sent me straight back to A&E with a letter saying, please admit this person. He needs sorting out. We told them I was autistic then, and the experience I'd had 3 days earlier, and they fortunately put me into the relatives room in A&E, which was quiet and away from all the noises and all the other sensory inputs, which we thought was really, really good. Eventually, I was called through to the other side of A&E where you get treated, and again, one of the doctors said, "You're autistic." Yes, I see that on your notes. What is it you want us to do? So I said, there's nothing specific. All I want to do is be kept up to date. I'm here. I don't know what's happening. I don't know what you're doing. The doctor said I need to be admitted, but obviously I've not been admitted yet, so I need to know what's going on. So 6 hours later, I was finally sent home, and nobody had really told me anything. So despite the going into the relatives room, despite the doctor asking me what I needed, it wasn't actually acted upon. So it was almost as I'd wasted my time, really. So I really, if somebody says they're autistic, then please deal with me like that. If somebody says, what do you want to do? And I tell them, what do you want us to do? And I tell them, then do it. What's stopping you? I don't expect people to realize I'm autistic. I've already said it, that I mask incredibly well, but just because I'm masking doesn't mean I'm not paddling like mad underneath. And just because I mask doesn't mean I have mild autism. There's a common saying that it's not that my autism is mild, it's that you experience my autism as mild. I'm still autistic. I'm still struggling like mad underneath. But because of the masking, I hide it. But understand that I'm still struggling. Even though I don't show it, I am still struggling. So if I tell you, please treat me, please understand that I am doing that.
People, not just autistic people, but people in general, neurotypicals, we often assume that everyone else's experience is the same as ours. And perhaps if you're neurotypical and neurotypical people form the majority of the population, then your experiences are more likely to be shared by those around you. However, when we're talking about people who have a different neurology, a fundamentally different system of processing information, it will be really easy to miss things or make assumptions around someone's experience or understanding. So personally, for me, so I'm a nurse. I obviously have a degree in nursing, post-registration experience and qualifications and lots of knowledge, I guess, relevant. When I was struggling to sleep, I contacted the ADHD team because it's something I know is very common in ADHD, not to be able to regulate sleep patterns well, and to struggle with sleeping. So I contacted them and said, look, this last month or so I've been really stressed, I've been really struggling with sleeping, can you advise or suggest anything? Anyway, they prescribed me melatonin, which was super helpful. And for the first night in 37 years, I got proper sleep. And I was absolutely blown away. I was like, I have slept so well. You know, it took me 20 minutes to fall asleep. I slept for 8 hours. And I woke up feeling refreshed, like rested. And is that what it's normally like? And everyone was like, yeah, that's what normal sleep is. But when somebody is constantly asking you, do you sleep okay? How are you sleeping? Is your sleep normal? I was like, I've always thought it's normal because it's normal for me. But I had no, when you have no frame of reference as to what acceptable or what the necessary level is, you're never going to know if something's abnormal or insufficient or not adequate for well-being. So it was absolutely, well, it just blew me away to find out that that's what sleep is supposed to be like. And all my life I felt tired all the time, and it was always just put down to anxiety, depression, just general poor mental health. Oh, go for a run, you know, do some exercise, cut down screen time, spend time outdoors, socialize more, socialize less. You know, the onus is on you to change what you're doing as if somehow your lifestyle and the choices you make are affecting your well-being. And by all means, yes, it absolutely can. But also consider that it might be something more fundamental, something more basic, something more glaringly obvious than that. And even as a healthcare professional with lots of experience, I had no idea that what a normal or adequate, what a proper night's sleep meant. Whether or not I was, and then whether or not I'm getting that or not is irrelevant if you don't know what you're comparing it to. So context is really important, especially when we're talking about pain. How is your pain today? Oh, it's okay. Well, actually, we need to sort of quantify that a little bit more. It's much more helpful to ask, how is it affecting you? Is it stopping you doing anything that you enjoy? Are you able to, cook food? Are you able to do a load of laundry? Are you able to climb the stairs? Are you doing it less than normal? Is the pain waking you up in the night? If so, how many times? We need more information in order to find out what that level is, because when you don't have the information you need to be able to say whether it's okay or not, the information you get back at the end could well be useless.